Hello, and welcome to Brewing Brilliance, a podcast where we talk to academics from across the university who are involved with the Healthy Ageing and Chronic Conditions Research Institute. We will be speaking to researchers who are leading innovative interdisciplinary approaches to promote lifelong health, delivering improved interventions to manage chronic conditions more efficiently. These sessions are essentially opportunities for us within the Healthy Ageing and Chronic Conditions Research Institute to meet colleagues from across and beyond our faculty to foster knowledge sharing, collaboration and networking. My name is Adrienne Cleverly, and today we are joined by Dr. Rachel Churm, who is a senior lecturer based at Swansea University. She is a dedicated early career researcher with a focus on lifestyle modifications, particularly in the context of postmenopausal women's health, with a research background resonating in obesity and type 2 diabetes. So, thank you for joining us.
Thank you for having me.
And I guess I should start by asking, how did you find yourself focusing on these two areas?
So originally, I'm in the Faculty of Science and Engineering now, so over in sports science. But originally, I did my PhD here in the medical school and, based in this faculty. And I focus a lot on essentially thinking about how our cells change and adapt to our fat storage. So how different things in our life things like diabetes and things like our hormone levels can affect the way then that our body stores our fat. So from that, I kind of was really interested. I looked at different drug interactions and I looked at different things like surgical interventions, such as bariatric surgery. Really enjoyed my time, loved it. But a lot of my work was very much looking at a cellular level. So those are the work. I didn't really get to meet many of my participants and my patients. We just kind of went in and I used to take little snippets of fat from surgeries and do my analysis in the lab. And as much as I really enjoyed that and I really enjoyed the pathways that I was investigating, I found myself really kind of missing that sort of participant engagement, and I wanted to do a little bit more in actually how can we do something prior to surgery, so before they get into this point. So that led me then to applying and taking up a lectureship in sports science, where I looked at how we can actually try and improve people's lifestyle to kind of mitigate some of the risk that we see then that could result from this dysregulated fat storage then. So initially, we started off with a project where we looked at individuals we were hoping to look at individuals, didn't even get that far, who had pre-diabetes. So they were kind of already at this higher risk level of developing type 2 diabetes. And we were seeing that within their profiles, they were having a bit of a dysregulation of their blood sugars. When we were having them conversations and we were speaking to participants about what it is that they felt the research could help them and what it is they were willing to do, because as somebody who wasn't from an exercise background, I always found when I met patients in clinics or when I was interacting with individuals, one of the biggest barriers was actually what people were willing to participate in. So we wanted to make sure that when we came up with this lifestyle intervention, it was something, or these lifestyle interventions then as a package, it was something that people would engage with. And from having them conversations, it was actually from a lady who was present in one of these conversations who was quite frustrated around the menopause. And what we saw then is that they felt like actually there's news and there's press and there's information around how their risk is different, but they didn't really know why or how or, what that story was, or there wasn't much information or evidence out there for them. So there's a little bit, I wouldn't say naughty, but we were a little bit cheeky and we kind of changed our tact at that point because we thought to ourselves that we've been really lucky to have somebody who's spoken so openly about their experiences that we were actually kind of developing this participant-led question. And from that then we changed our design a little bit to start looking at the menopause and the changes that happen there and to see what risks were exposed and lifestyle interventions in them particularly, and focusing back on then what I would say would be more my bread and butter and thinking about them fat cells and how they can have an impact in certain metabolic conditions.
That's really interesting because you sort of you forget, don't you, sometimes that when you're behind the scenes, you miss that face-to-face interaction. And usually research is based on people that are living it, aren't they? So you kind of need that interaction.
100%. And if anybody knows me, they know that I could chat for days, and I do love an in-person interaction. And that's just it, is that, like, you know, we were receiving, I felt a bit disconnected from some of the research that I was doing when it was coming as a blood sample and that side. And it's amazing and brilliant work, and I can't stress that enough. And it takes way brainy and dedicated people than myself, I think. But I did enjoy the idea of being able to take a step back and to go back to the individuals to be able to find out what would work for them and how we could create interventions that would be feasible for them.
And is that kind of how you fed that obesity element into the menopause then, and into that level of research?
Yeah, so within the menopause, many changes happen on a hormonal level and also on a personal level as well in that point in somebody's life. And I think that we forget that the menopause transition tends to happen when, I like to call it, when your man management mode is a bit in overdrive, or it might be at a point in your life where you're receiving a lot of mental load, whether it be from children going to university, whether it be children sitting GCSEs, whether it be they're not from children's side of things, but from, you know, your parents are getting older. It's a point in life where women might be striving for promotions, or they've set themselves up in careers and they have quite demanding jobs. To have then these big, significant physical and physiological changes happening, that can have quite a significant impact. And one of the changes that we've seen in some of the research kind of points towards that it does also change the way that our body stores our fat. So by losing some of those hormones that we would normally have up to our life, so estrogen, this lack of estrogen then can shift some of the pathways in our body to store our fat in a bit of a different way. So you do start storing your fat more around your tummy rather than your hips, which you would have done beforehand. And this can have a big impact on women because of social media, everything else. We're really predisposed.
Lots of environmental factors, isn't it? And you sort of you forget sometimes about how things like that can influence. But also menopause right now is quite a live topic.
Yeah, so we originally started this work, I think, well, I said this the other day, and I don't know how correct it is, but I was like, pre-Davina McCall. Yeah, it's like BC, BDM. So pre-Davina McCall. Before that, we kind of started this topic of research and started going into, and it has really kind of blown up, thankfully so as well, from, you know, celebrities and different, just more information is being shared about it. There's a lot of information shared as well about kind of how women's health is a little bit neglected in research, and predominantly the models and stuff that we work off in medicine or in care is not actually based on women's experiences and across the different parts of their lifespans. So, you know, it is something that, you know, was getting a lot of traction as we were doing it. And it was quite nice to actually be involved in that. And it was really nice to see that there was appetite then to hear about, like, the studies that we were doing and about the women's experiences that were part of our study as well.
So do you find then that because it is a live topic, that the data that needs to have that big impact, it needs to have that statement attached to it?
Yeah, and it's a bit difficult as well, because I'm always the first one to say, as you mentioned, that I'm early career. I think about I say early career forever, and unfortunately getting older like everyone else, and our time here in Swansea is getting longer. But, you know, research takes ages to come through, and like the research that I talk about, I always have this big caveat, like, you know, it was one pilot study that was based off a feasibility study, and research takes years to come through, and we're 5 years into this now, and in reality, you know, we've got 2 publications and we've got a third one coming out now, and it's very new work, and it is piloting what it is, and only now are we able to actually have the information to apply for the grants to get, no, to hopefully get a bigger study in place to be able to get the true evidence behind it. So unfortunately, I think there is a little bit of like research catching up with the media in terms of, like, you want things to have impact, but you do need to be cautious in what you're selling then, in terms of like sample size and, you know, what you've done and the information you have in your trials and your interventions. And it's being realistic about that as well, isn't it?
And I think you sort of touched on something there that isn't really talked about, in the sense that 5 years down the line and how long research can take.
Yeah.
You know, that emphasises your pre-Davina McCall.
Yeah.
But it's
a significant time in life.
but it does give that sort of understanding of how meaningful the impact needs to be able to push the research further.
Yeah.
I mean, have you learned anything along the way that you think might help with that, or?
I always say with us, and again, if anybody knows me, I'm always very open, and I'm very open to anybody's suggestions and collaboration. We're very happy to kind of share data and be open, and we try to use data repositories with our data to make sure that all these little bits of data can hopefully then create a bigger master file. So if people are more in a position to be going for these larger scale applications, they don't always have to start back at ground zero like some of the work has to, you know. But yeah, no, it is, I think, unfortunately, as you say, with science, it's just time, isn't it? And with research, I think that we often forget that how long things do take to come through, isn't it? And our population itself, you know, if you're doing an intervention study, like we looked at women across an 8-week period. So with us, we had to go out there, find women, recruit women who were of a certain demographic or were part of a certain population. You know, ideally, we didn't want them having any other pre-existing medical conditions or health conditions to try and keep some of that variability down, because we were looking at health markers. So obviously, if they had dysregulated glucose to begin with, then obviously they would have a different profile to somebody else in our participant groups. And then trying to get them to engage in a lifestyle intervention over that period, again, takes significant time. So to be able to get enough people to split across 3 arms of a study, you know, took us the best part of 2 years to get them even in.
And on that, you've already touched on how environmental factors influence what you're doing, but it also impacts on how you recruit, doesn't it? You know, because if you're asking for someone to give a length of time, was that something that you struggled with as well, or was that...
So one thing that we were blessed with then, or one thing that we really did try to make sure was apparent, was that we always took our participants' feedback. So originally we did a small scale feasibility study just to see whether our kind of lifestyle protocol or the exercise programs that we were kind of recommending then or asking individuals to do, we made sure that within our feasibility we took all of that feedback on board to ensure it's something that women could do. And I always joke about, we were given this golden hour, essentially, was our feedback, our main piece of feedback, where, you know, women really wanted to be able to get changed, get it done, get out, dry shampoo or wash their hair, depending on personal preference. But yeah, you know, and it was about it being able to fit into people's lives. And that's really what we were trying to do. So our dropout rate was actually quite low for what you would normally see in exercise trials. So so it meant that we did keep our people from week 1 to week 8.
Do you think that might have been because of the topic you were actually researching?
Yeah, so one thing that we did find was that obviously within this topic, like, people were coming in, and I think with women, especially in this time of life, they are frustrated and they are motivated for change, I think. And it's a lovely thing to see. Especially when you see people coming in, you know, they're fully aware, and sometimes they don't want to have to go down a medicinal route, or they don't want to go down like a prescribing route, or they feel like they can't go to their doctor about things. And I think many of our women towards the end of it then, you know, anecdotally from conversations that we had, they felt like, you know, they were able to do something, like it was there. And they were kind of, I think that helps drive them across the 8 weeks then, seeing them little changes kind of empowers them to keep going.
And changes that are meaningful to the participant as well as to your research.
Yeah.
Because whatever way you look at it, both of your obesity and your menopause, I'm assuming, this is an assumption, have got a stigma attached to them.
Yeah, and that's just it, isn't it? As I would say, especially as well, like kind of that increased kind of abdominal obesity or adiposity then, so carrying that weight around your tummy or that central mass, I think specifically in women of that age is like like people have slang terms for it and people use derogatory terms for it as well, and yeah, there is that element of it there. But as I say, our data that we have, I'll stress this again, we didn't, this is anecdotal, this is just my experience with the participant and not our research findings, in terms of we didn't evaluate that and like their perceptions or their feelings on that. But yeah, they do feel like they're out of luck and there's nothing they can do about it. And it is difficult as well when you have conversations with people, because you're trying to explain to them that there is a physiological reason behind it as well. It's not just you've got lazy or you're not doing enough.
Yeah, because you hit a certain age, don't you? And then it's easy to sort of say that or use
And you get busy. And I think that, people get busy and, so as I say, there is that element of it. So trying to find like feasible chunks of activity that we could give individuals that they kind of wanted to do, or they didn't feel too put out by doing then, just try and drive some of their metabolic changes, I think was quite, we had a good time and we really enjoyed the study and we're hoping to expand it further.
That was my next question, was are you going to continue with this,
Yeah, we've got applications going in now to be able to actually push this forward and to bring together, and the Healthy Aging Institute have been amazing in that, especially, and the Health Technology Institute in the FSC have been really great in it, being able to give us a platform to kind of get the connections, not just within our institution, but across different institutions, to enable us to actually have the conversation to say, well, it's taken us this long to get this population here. We need it from everywhere, So, and I think that that's our next step now, is to be able to grow this and see whether we can actually implement it on a real world scale.
On a real world scale.
So
on that note, are people happy to reach out to you if they would be?
Absolutely.
So I would love to sit here and talk to you much more about this.
We go for days.
Because it is, like we've already said, it is a live topic, isn't it? So, it's meaningful.
And it affects everybody, whether you're a man or a woman, whether it's your mother, your sister, you, it's, it could be your partner, it could be their mother. It affects everybody. And I think that, the more people speak about things, the better, isn't it?
Yeah, and especially breaking down barriers and enabling people to speak about it and understand it.
Yeah, exactly. And I think that whenever you've got a topic that's so, like there's new stuff coming out every single day. We have one of them little PubMed updates I'm sure everybody has that gets emailed to them. And every time I look at it, I go, crikey, like, it's, even when you are absorbed in that research, it's hard to keep up with what's coming out. And it's trying to fight from the wood from the trees from the woods, to be able to determine, what has got that kind of impact then, or to see what's really truly coming out. And I don't think anybody is, there are obviously brilliant world leading experts in it, but I think that everybody is just trying to learn and keep
grow
up and grow. Develop, 100%.
Do you know what? I could honestly carry this conversation on. So when you get your next bit started, let me know. And can you come back and tell us about that as well?
I just need to get all that funded. But anybody's got a lottery ticket? But
if you have, please reach out to Rachel.
Yeah, please.
But on a serious note, that is very, very interesting. And I've really enjoyed talking with you. So thank you for coming in to speak and share your story with us.
Thank you.
So if you would like to find out more about Rachel's topic of obesity and the menopause, then please visit her staff profile page on Swansea University website. That's all from us today. If you have enjoyed and would like to find out more about this podcast and the Swansea University Research Institute, please follow us at Swansea University. We're under the Medicine, Health and Life Science Research Institute, and we're under Healthy Aging and Chronic Conditions. Thank you, and thank you once again.
Thank you again. Thank you.